News everywhere.
When we talk about putting more law enforcement into spaces that generally don't see law enforcement, that should give us some cause for concern.
Police are becoming a common sight in city hospitals, and in addition to taking away resources from the service, some say their presence is having a significant effect on patients. Between 2012 and 2021, police have spent the equivalent of 1,900 days at city hospitals, with duties ranging from monitoring an in-custody patient to assisting with sexual assault investigation protocol. While programs like the Alternative Response to Citizens in Crisis pilot are intended to ease the requirements of police at hospitals, institutional safety officers promised by the government more than 3 years ago have still not been implemented. Health Minister Audrey Gordon says she's had in-person meetings with nurses on the front line to discuss safety concerns, pointing to the introduction of amnesty lockers at HSC Winnipeg as an example of the work.
We have immediately, upon hearing about these issues, taken steps as a government, and we will continue to listen and do what's best to ensure not just individuals working in our health facilities feel safe, but patients and family members that may be visiting those sites as well.
NDP health critic Uzoma Askawera says they feel the failure to deliver on the safety officers at a time when wait times and tensions are high only escalates the problem.
People are waiting for, and we've seen some folks over 100 hours to receive care in our emergency rooms. That is unacceptable. So it's another failed, broken promise from this government, and it's happening at the same time that their decisions and their cuts to healthcare are actually creating less safe workplaces for our healthcare workers.
University of Regina assistant professor James Gasick focuses his work on the intersection of law enforcement and healthcare. He says many people in marginalized groups already have negative experiences with the system, the presence of police potentially serving as another barrier, pointing to the underfunding as a root factor. Gasick says it's the provincial government's responsibility to keep staff safe and handle potentially high-need patients without constant law enforcement intervention.
When you don't have provincial governments that see healthcare as a priority, when they don't fund it properly, when they have ongoing systemic concerns with recruitment and retention, given how healthcare workers were treated during the pandemic, it's unsurprising that we see the results that we do.
In Winnipeg, Modjeski, City News.